listen to a young girl who was saying that the Nigerian community here is totally very angry. Thank you very much for listening to your places of our
President was the Ijo country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools. His major academic emphasis was at Government College, New Delhi.
Go gather, destroy their food. Make security camp and that other camp, second camp. You don't compensate everybody.
In its key generation sometimes. Today I hope we can be in the style of J.P. Clark, a poet and writer, and we shall also be very interested in his point Agbor dancer.
Some lives are meaningful, some are empty. Lives that are meaningful, with too much meaning and riches to offer humankind. After some of these earthly adventures and more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet.
Good day. Thank you very much for talking to people, places, and events, and the African Center for Community and Development, and thank you very much for visiting the Earth Complex. What is your name, sir?
Charles N Agbor.
You are the director, the founder, or CEO of an organization. What is the name of your organization?
My Doctor International, operating in Cameroon as my Doctor Cameroon.
And you are into preventive care. And what does that mean, and what kind of activities do you carry out?
We are actually into preventive and healthcare maintenance. What we do is we encourage members of the diaspora, or even those who are in Cameroon, to become members of a company, and the membership fee is $240 a year, which is about $120,000 a year, and that gives you access to a personal physician whom you can call at any time when you're sick or not sick, or for advice, 3 times a year. When the doctor sees your loved one in their homes, we only practice in homes, only when they're very sick then do we take them to clinics. When we see them, they do a baseline assessment, so it will be physicals, some people have never had a physical in their life. We do that, and there will be maybe some prescriptions or some lab work, and you, the member, pays for that. But you have access to that doctor and to all other physicians who are associated with us.
So far, what has been your outreach? Have you been having some clients, or are you facing some challenges?
Both. Clients. We do have some clients right now, mostly in the southwest area, from Limbe all the way to Kondo Titi. We have one in Nguti, we have a few in the North province, and a handful in Central, that's here in the area. We do have a lot of doctors, and a lot of doctors that want to come and work with us because they think that is the direction of medicine. Challenges. A lot of our people, even those of us who are educated, still don't understand that preventive care is better than hospice care. And let me talk a little bit about preventive care. Is when you spend time with the person, educating them, maintaining what they have now, giving them medication for the simple ailments so that they don't become gravely ill. Sometimes we wait for parents to call us at 3 o'clock in the morning when they're in the hospital, very sick, and then that becomes more like hospice care, where if we're not careful, it transitions to death. We want to prevent that. And it's something that everybody is practicing in the rest of the world but us.
Now, in terms of the infrastructure of medicine in Cameroon, how do you think that is playing on the outcome of your work and your institution? Are you capable of liaising with doctors freely, or you think it's more challenging in terms of like you have to create some kind of collaborative agenda which is difficult to maintain?
What we do is actually the doctors who work for us here work for us as independent doctors. They have ironclad agreements signed with us with non-disclosures. And we really don't have problems finding the doctors. As a matter of fact, some of them are finding us because a lot of us in diaspora, when we call for them to help our parents, most of the time we end up not paying them or delaying their payment. And they think this modality that we're instituting will give them access to the diaspora and to good medical care for their parents. Because there's a reporting structure here. Once the doctor sees them, they do write out what we call a medical brief in simple English, typewritten, and it is posted on a medical health database which the member has access to. And you can read that and converse with your doctor. So at the doctors that we're dealing with, most of those who hear about us want to become part of us.
Now, what has been the reaction from the diaspora?
It's been lukewarm, which is not to be, I think it's to be expected. Because people want to see if something really works before they dive in. A lot of us are people who come into something that's established, and a lot of us are people who jump in and make the thing established. And we have both. A handful are diving in and making it work. And as more and more people hear about it, they ask us a lot of questions, and then they get interested. And that is where we want it to be. We want it to grow not in leap and bound, we want it to grow instrumental. It is privately funded, so we own allegiance to any stockholder to show them the bottom line. It is mostly based on the fact that this is a mission.
Okay. Now, what inspired you?
Personal issues. Number one, my father died, and I still don't know what killed him. This is a man who was in the police force for a long time, retired to the village, and he died. Despite the fact that money is sent monthly. I still don't know. It's almost 14 years that he's been dead. My mother, who is 96 now, lives in Sokolo. She had glaucoma, and my relatives took her to some places and they punched her eyeballs out. So she's blind, legally blind for the past maybe 20 years. Those are all two things that I could have been instrumental in lengthening my father's life or making sure my mother has sight. So I decided I was going to get my own personal money from my trust with the help of my wife and do something that other people like me never go through the kind of grief I'm going through. So this program has started giving life to my father for me and sight for my mother to me.
Wow. Have you been collaborating with some other organizations, let's say civil society organizations, in order that this information that you have and the activities that you're about to do can reach out to the nooks and crevices of society?
I have really failed in that area because I really haven't had the tentacles to get through that. But it's something I really want to do. I have actually a few church groups have talked to me. I've had some bloggers in the U.S. try to get people to know about me. I've talked to some not CNN, to CRTV, Canal 2 in Cameroon. So we're 2 years, 4 months old, and I think that eventually we'll get to those kind of organizations. If they're available, we're here. Now we want to partner with anybody that has foresight as to how we can help our people or can be of use to our people.
Now, can you greet your people in your dialect and to tell them the wonderful work you're trying to do?
Let me see. Onanyima, when I married Charles Agbor, company I married my doctor Cameroon. Where forward Dr. Mbongaya Kanjuya, Pengo Kejakan, Kembong Ewele, Mfuni, Bukebe Ejenji, about Kibwaka, Kogianjuya. So when I said I don't go say company nyo are a company nyo akeba kulawan abla kanju.
Thank you very much, Mr. Charles Agbor, for visiting the Health Complex and for talking to the African Center for Community and Development. And I wish you good luck in all your endeavors towards helping people who are sick in Cameroon and out of Cameroon in the diaspora.
Thank you very much. This is a wonderful complex. The Earth Complex kind of connects to my Dr. Cameroon too. So I feel really inspired being here. Spent a wonderful time here, and I do encourage all the people in diaspora to think of a place like this. It's more homely, it's friendly, and it's a lot of hard work to make you feel at home.
Thank you very much.
Thank you very much. And you just listen to a young girl who was saying that the Nigerian community here is totally very angry. Thank you very much for listening to your blessings of our government.
It was the Ijo country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools to make your academic tendencies was as government college to Delhi. And
go gather, destroy their food. Make cultivated camp and that other camp, some camp, no compensate everybody. But some of them
in each generation sometimes. Today I'm focusing on the style of J.C. Clark, a poet and writer, and we shall also be very interested in his point Agbor dancer.
Some lives are meaningful, some are empty. Lives that are meaningful, with too much meaning and riches to offer humankind. After some of these earthly adventures and no more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet.